Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
So, as part of this back program, Brad, it really is incumbent upon us to make sure that you're going to see the doctor in a timely fashion if one of these things happens.
Sure.
I want to make sure that you're not, sitting at home and letting things get worse, and all of a sudden you're going to need surgery.
Right. 'Cause,
So-
there then these situations, which doesn't happen very often.
No, they don't.
but
They're rare.
Yeah, we'll let you know if you answer these. Then you need to see the doctor much sooner than later, and we'll let you know if it's an emergency.
Right.
Or-
So if the pain starts traveling down your leg and it goes below your knee, I would probably see the doctor.
Yeah.
Because
You
we
got a
think it might
pinched
be
nerve
setting.
probably, yeah.
Right. Brad, do you want to take the next one?
Oh yeah, if your leg, foot, or groin or rectal area feels numb, and you may have some control with bladder control
Right.
or
You
even
could have some tingling sensation.
yeah, where you sit in a saddle, everything is numb in there. That's a big problem, and you need to see the doctor. You may even want to go to the emergency
That's
room.
one where you see the doctor right away.
Right.
Yeah.
If your doctor's not available, go to the emergency room.
Again, I don't know if you kind of caught that, but it's called saddle anesthesia.
Yes.
Because the area where would cover saddle would contact
Right.
is where you would have the sensation. So
Yeah.
if you have a fever, nausea, vomiting, stomach ache, weakness, or sweating, you're not feeling well, and you're having back pain, you actually should probably see the doctor.
And you're saying that they came together at the
Right,
same time.
right.
It's not like you've had back pain chronically for the last month and you get sick. Then they're not necessarily related, but
You're not going to be surprised to hear this, Brad, but I've been seeing now. In fact, we're going to have a doctor on to talk about this.
Okay.
With COVID,
Yep.
you actually could get excruciating back pain.
okay. Wow.
With Ellen DeGeneres got this.
Oh, really?
Yeah. Do you know who she is?
She's a woman, I suppose. I don't know.
Yeah. She's a comedian. So, all right.
I don't
Like
get out
Brad
much.
said, if you lose control when you're going to the bathroom,
Yeah.
that's a
Yeah,
sign.
that's very critical.
How about next one, Brad? Your legs are weak. You want to take
Weakness in the legs. So a common one is if you're walking and you have foot drop or foot slap where your foot just drops and you have a
Right.
hard time dorsiflexing or doing that. So that's weakness in there. That's L5 nerve is being impinged one way or another. Then you need to get to the doctor, or if you just feel weak and you have this tendency to actually drop
Yeah.
or lose your balance, get to the doctor right away. That's a big problem.
This you wouldn't think you would have to say this, but if your pain was caused by injury or trauma such as a back, such as a car accident, you gotta see the doctor.
Yeah, right.
And what's funny, you have the adrenaline after a car accident, so it may not hurt till the next day.
Right, exactly. That's very common because, like you said, the adrenaline's going.
Yeah.
I feel okay now. I mean, you just happen to
Right.
be alive.
Yeah, exactly.
Or the inflammation hasn't swollen and created the
Right.
pain yet, which happens by the next day.
How about the next one, Brad?
You're. Bob, it's
Your
not
pain
even-
is so intense.
You didn't put asterisks on the
You
list.
can't move around.
Yeah, when you can't, and I've had that where it
Yes.
and you're walking kind of like this, and it hurts, and you sit down real slow.
Right. And the final one, it just doesn't seem to be getting better. If you've had it for 2, 3, 4 weeks, you probably should go in and make sure something else is not going
Right,
on. If it's the first time you had back pain, if you normally get back pain,
Yeah, you went out and you
Right.
did something silly. You started cutting a tree down or moving some brush or did some gardening for 3 hours, and it typically hurts after that. People usually know that.
just as a final statement, Brad, I want to let people know this video is a part of a series of videos on back pain. It's for free. You go to bobbrad.com, go to the program section. You'll find one on sciatica, if you have sciatica, and also on back pain, and also on shoulder pain,
Right.
knee pain.
Right.
pain.
Yeah, we got foot pain, plantar fasciitis. The beautiful thing about all these programs, they have a title of anywhere from 20 to 40 videos per diagnosis.
Yeah.
And there's a free PDF printout that shows the exercises and a review of the video that goes along with
Got
it.
photos with it.
Everything. And we don't even ask for an email. It's 100% free.
Right. No friction.
Frictionless.
Yes.
That would be the same, right? Friction.
Right,
No
yes.
Yeah. Okay.
All right. Thanks for watching.